I'm Dr. Asai here with a new sonography discussion on fetal nasal bone hypoplasia. Don't forget to subscribe for every Monday new sonography discussion. First of all, we will talk about how to measure fetal nasal bone. Then we will discuss about fetal nasal bone hypoplasia associations with other anomalies and fetal syndromes. And at the end, we will review a case with nasal bone hypoplasia. In order to measure fetal nasal bone, we should get the mid-sagittal view of the face. To obtain this view, we should see three echogenic lines. Three echogenic lines are nasal tip, the skin over the nose, and the nasal bone. Here is a normal fetus in mid-sagittal view with a normal nasal bone as we can see here. In real-time sonography of the same fetus, we can see the mid-sagittal view. Here is the lower and upper lips, the nasal tip and nasal bone here. We can see forehead of the fetus, again nasal bone. If we freeze the image and measure the nasal bone, it's about 6 millimeter, which is normal in 19 weeks fetus. There are many charts to estimate fetal nasal bone in different gestational ages. But in my experience, in anomaly scan of 18 and 19 weeks of gestational age, it would be 4 to 6 millimeter. Here we can again review the nasal bone. Forehead is here. We can see the ear of the fetus, the eye, and the lens of the eye. Nasal bone again, the upper lip, lower lip, the chin, and the neck of the fetus. Here we can see also the fingers and the other eye of the fetus. Nasal bone hypoplasia associates with aneuploidies like trisomy 21, trisomy 18, and trisomy 13. Here we have 18 weeks fetus with nasal bone hypoplasia. First of all, we will find mid-sagittal view. As the fetus moves, we try our best to get the best mid-sagittal view of the face and nasal bone of the fetus. Here we can see the mid-sagittal view. The lower lip and chin is here, upper lip. We can see a small nasal bone. So if we measure, it's about 2.6 millimeters. Again, we can measure it here. It's about 2.7 millimeters. So we can see nasal tip, nasal bone in mid-sagittal view of the fetus. Again here, we can see hypoplastic nasal bone, nasal tip, upper lip, chin and lower lip. In the same fetus, if we find three echogenic lines, nasal tip, skin over the nose, and nasal bone, we find a hypoplastic nasal bone in the fetus, which is obvious here. If the video was helpful, don't forget to like it And if you have any question, be free to ask it in comments.